Panthers, and I'm going to be your student nurse today. Can I get your name and date of birth, please?
Yes, my name is Shirley Gibbons, and my date of birth is May 5th, 1964.
Perfect. It's so nice to meet you. Do you have any drug allergies that I need to know about, please?
Yes, I'm allergic to codeine and sulfa, and also I'm allergic to latex.
Okay. The procedure that we're going to be doing today doesn't have any contraindications for those allergies, so we will proceed. So based on the patient chart that I have here, your physician has ordered an NG tube to be placed. Are you familiar with an NG tube?
What's an NG tube?
An NG tube is actually going to go through your nose, down to your throat, and into your stomach. And it's going to get rid of some of that gastric content that you have in your stomach right now. Because I understand you've had some nausea and vomiting today?
Yes.
Okay, so this will help relieve some of that buildup and that acid that you've got in your stomach. Is it okay if I proceed?
Oh, please.
Okay, let me just get my supplies ready and you can just relax. So we've got the tube here, and I'm going to put some lubricant on the tube, so hopefully you won't feel very much. I will talk you throughout the procedure, and so when we get to the actual insertion of the NG tube, I'm going to ask you to swallow for me because we don't want you to get that NG tube stuck. It'll help make that NG tube go down for you.
Okay.
Gloves are not going on this morning. There we go. So I am going to raise you into a very high position so that you are sitting up. So let me know if you have any discomfort, please. This is called high Fowler's position, and you're going to be sitting straight up at about 90 degrees. Any complications so far?
No.
Okay. Now this is a towel that I'm going to put across your chest, and this is just A, to maybe keep you a little warm, and B, just to prevent any of those gastric contents from going onto your sheets or your gown. So this is the NG tube that I'll be putting down your throat, and it looks like, I don't see an expiration date on here. Oh, here it is. It looks like it expires August 2020, so we're doing good on that. I am choosing the smallest device that we have just to prevent any discomfort. Okay. So now I'm going to prepare the tape, and the tape we're going to tear off 3 separate pieces of tape. And I'm just going to put them right here on the side of the table for you. Because I want to prepare all my supplies so that I'm not having to tear tape during the process. So I'm taking one piece of tape that's going to secure to your cheek. I'm making another piece of tape that we're calling the blue jeans, which is going to secure to your nose. And then I'm making another piece of tape to act as my marker on the NG tube. Okay. I'm going to pull back on my syringe here because I need to aspirate your stomach contents once I insert the tube. And we're going to go back between 20 and 30 milliliters. And then this is the safety pin mechanism to secure the tube once it's in place. Now the next thing I'm going to do is I'm going to check for patency in your nostrils. Do you have a side that you prefer? Have you had any surgery that I need to know about?
I've not had any surgery, and you can choose which side.
Okay, so if you don't mind, I'm just going to occlude one of your nostrils. Can you breathe out? Okay. Whoops. And I'm going to include this nostril. Any preference? Otherwise, I'm going to go on the right side.
Okay, that's fine.
Okay. Next, I'm going to measure the tube to make sure that I'm in the right spot. And I'm just going to pull your gown down just a little bit. Okay, sorry if you're going to be cold for just a little bit, okay? So I'm going to take the tube, measure it from the nose to the ear, and then I'm going to measure it from the ear to the xiphoid process. And we're at about 55 on the measuring. I'm going to take that piece of tape that I tore off and to just mark so I know how deep I need to go. Next, I'm going to put the syringe onto the end of the NG tube because you don't want to you want to prepare your supplies as efficiently as possible so that you're not doing that with one hand. Next, I'm going to lubricate the tube. And this lubrication is very, very slippery, so when you're lubricating, just make sure that you are spraying into the bucket and not on the floor because we certainly do not want any accidents to occur. Okay, I'm going to put your gown up here, put the towel back up here. And here is a bucket right here. So just in case you feel as if you might be getting sick, this is where I want you to vomit, okay? Okay, I'm ready to proceed. Are you ready to proceed?
Yes.
Okay, now what I want you to do first is I want you to tilt your head back against the pillow. And I'm going to go at a horizontal to the top of the throat. Okay, now when you start gagging, swallow for me, please. Okay. Can I ask you to speak, please?
Hello.
Now, I'm just going to check inside your throat to see if there's any coiling. Okay, there is no coiling. Next, what I'm going to do is I'm going to listen to see if I hear an air bolus. Okay, I hear the air bolus. Down here. Next, I'm just going to pull out some gastric contents and let's get you covered back up here. Okay. You just need to pull back just a little bit, just enough to make sure that we can assure we're in the stomach. And so we're looking for a pH between 4.5 and 5.5. There we go. Pull my pH strip. Okay, put that down. I'm going to put that in there. Good. And then based on this pH, it does look like we're about a 5 here. So we definitely have the tube in the right place. Next, I'm going to call for X-ray to make sure that we're verifying placement. Okay.
X-ray is good.
X-ray's called, so now we are ready to proceed with the final taping and putting this tube up to suction. So So I'm gonna put this tape on the nose. We're just gonna go around the tube. And then we're gonna go the opposite way around. Okay, how are you doing so far?
I'm doing okay.
Okay, next I'm gonna hook it up to suction. We're gonna grab the straight connector. And you're going to attach it clear to clear. And then to turn on the suction, you want to make sure that the suction is working before you turn it on. And then you do want to make sure that you're in the green zone or low intermittent. If we have it on regular, it means that the suction is continuously processing. By having it on intermittent, it means the suction is stopping and starting so that we're not creating more complications for the patient. Okay, how does that feel?
It's okay.
Not the most pleasant, I'm sure. I'm just going to tie you back up here. And then my final step is to secure this to the gown for you so that it's out of your vision. Just gonna do what I call a tube taco. Gonna wrap that rubber band around the tube, and then you're gonna stick the safety pin through that. And you wanna give the patient enough room so that they're not pulling that tube out. Okay? Now the last thing that I need to do is to lower your bed. Now we have to lower the bed to only 30 degrees to prevent aspiration. And so if your family comes in and they want to lower your bed for any reason, you need to let them know that you have to stay at this 30-degree angle. Do you have any questions for me?
No.
Okay, well, thank you for allowing me to take care of you, and I'll come in and I'll check on you in a little bit, okay?
Okay, thank you so much.
Thank you. My name is Tina Mathers, and I'm going to be your student nurse today. Can I get your name and date of birth, please?
Yes, my name is Shirley Gibbons, and my birthday is May 5th, 1964.
And what are your drug allergies, please?
I'm allergic to codeine and sulfa, and also I'm allergic to latex.
Okay, none of the procedures that your physician has ordered for you today is going to be contraindicated for those allergies. Your physician has ordered this NG tube to be removed today. Do you have any questions, or is it okay if I proceed?
How long will this take?
It probably take about 5 minutes, no more
good.
than that.
Good.
Are you expecting any family to come anytime soon?
I don't think so.
Okay, then let's get started. How does that sound?
Good.
I'm just going to put some gloves on and proceed, okay? Was the family pretty compliant with keeping the bed at 30 degrees while you were here?
Oh yes, we didn't have any problems.
Good. Okay, so remember when I put the NG tube in, I put you up to that high Fowler's position, the 90-degree angle? We're going to do that again, okay?
Okay.
Let me know if you have any discomfort while the process is going on. How's that feel? Good?
That's okay.
Okay, now I'm going to put this towel across your chest. We're going to tuck it here. And right underneath here. Okay. All right, I'm going to go turn the suction off. So the suction is off. If you're documenting INOs, your fluid balances will be over here. Okay? I'm just going to DC this. And put this back here. Tucking. Take your little straight connector off. Okay. tape. There may be some pulling. I'll be as efficient as I can. Okay? Now, I want you to take a deep breath and exhale, and I'm going to remove the tube. 1, 2, 3. Okay, it looks like the tube is intact. How did that feel?
I'm glad it's out.
Good, I'm glad it's out too. So I'm gonna come back and check on you in a minute. In the meantime, I'm gonna lower your bed and just probably stay at the 30-degree angle for right now, but you shouldn't have any complications. Any questions?
No, thank you so much.
Thank you.